Welcome to Stall Side Podcast.
Brad, how you doing today?
I'm great today.
Yeah, that's good. Yeah, good to hear. So we've got Dr. Brad Tanner back on the show today.
Yeah, excited to have him back because I don't think people understand how advanced the stuff that Brad is doing is. You know, every time I run into him, even as involved in this practice as I am, he tells me something new that he's doing. I go, really? You're doing that? I mean, it's amazing what they're doing in a horse's mouth.
Yeah, I see a lot of them around the hospital and say, oh, what you doing today, Brad? And then he rattles off this procedure, which sounds really complicated and is definitely above my pay scale. But he's one of the few boarded equine dentists in the country, and he's practicing at a level that I think probably few people in the world are.
Very few. Yeah, I agree.
Yeah, so I'm very interested to see what he's going to tell us today about the reconstructive procedures he can actually do on horses' teeth, because once upon a time, if there's something wrong with a horse's tooth, you just pull it.
Right. Yep.
And it actually turns out that a lot of these things can be saved, and as horses are living so long now, this is really important to have that good mouth of teeth for as long as possible.
Exactly. So let's get him in here, and I'm excited to see some of the stuff he has ready for us today.
Yeah, absolutely. So on Stallside this week, we're talking to Dr. Brad Tanner about reconstructive dentistry in the horse.
If you like what you hear and see, be sure to refer us to your friends, and remember to hit that like button and subscribe to our channel. We've done a lot of great episodes already that you may need to catch up on, with more just around the corner. One last reminder, nothing you hear on the podcast should be construed as veterinary advice, which should only come from a veterinarian with whom you have a relationship.
Dr. Tanner, welcome back to Stallside.
Yep. Thanks for being with us again today.
Yeah. So Brad, just for anybody that didn't catch your first talk, tell us just a little bit about yourself.
Sure. Veterinarian here at Rood and Riddle. Been here for, since 2005. So since I was a newbie out of school, still had that new vet smell. Still enjoy it. Love working here. Love all my colleagues. Love kind of pushing the dental side of our practice. Boarded in equine dentistry and oral surgery. So that's a huge focus in my practice and what really drives me.
Talking about the services offered at Rood and Riddle, could you just give us a general overview of what you can have done for your horse when you bring them here?
Sure. I'm glad you asked that. When people think about dentistry, honestly, I would think most owners would think about floating teeth because it's one of those check boxes. You got to deworm your horse. You got to float the teeth, call the farrier, get the feet trimmed. There's just certain little boxes, good animal husbandry. And so I'm one of those boxes, right? So obviously you've got to float teeth, but here at Rood and Riddle, we are a specialty practice in every sense of the word, whether it's internal medicine, surgery, podiatry, in all aspects of what we do, diagnostic imaging. So dentistry is really no different. We're very lucky to be able to offer many services. So the field of dentistry, no different than human dentistry. We have endodontics working inside the tooth, like root canals, vital pulp therapies, teeth that are broken, teeth that are diseased, but maybe they don't need to come out. Maybe there's things we can do. There's periodontics, so gum disease, huge problem in dogs, cats. It's a huge problem in horses too, largely undiagnosed, and spoke about that previously with you guys. Orthodontics, we all have spent some money on kids getting teeth realigned, braces.
That's not cheap.
That's a racket, right?
The color has just gone out of Bart's face.
Yeah.
Oh, he got pale all of a sudden. He's got more kids than I do. So, we do some orthodontics as well, particularly overbites, parrot mouths. It can be an issue. And so there's some corrective procedures we do. We offer some consultation and some things we can do with that. Imaging, we're a huge hospital with a lot of capabilities. And sometimes looking inside the horse's head is really complicated. And, we've got this long head with sinus cavities full of air and gas. And then the enamel of the tooth, which is the hardest substance in the animal's body. You're trying to image a hard substance next to gas. The algorithms of digital radiography do not play well with that at all. So we've got a CT unit. And in fact, we've got a standing CT unit, one of the greatest ones in the world. And it provides amazing diagnostic ability. But we also have the ability to MRI. MRI is really helpful looking at the pulp inside the tooth itself. And then sometimes we'll use a bone scan. Sometimes we're trying to find something a little bit different around the tooth, or just find issues with pole, with bitting, because some of what we're doing sometimes is working with the trainer. This horse isn't holding in collection. This horse isn't taking the bit. We're having trouble with our performance horse. So that's a lot of what we do. And then obviously surgery. I'm an oral surgeon, so I'm taking out teeth. I'm inside sinuses. We're doing sinus trephination, sinus flaps, scoping, intraoral wiring for jaw fractures. There's a lot of things we do. One of the things we do that's really unique is kind of the restorative dentistry.
Mm-hmm. Yeah. And so on medicine, we'll get these horses that come in, maybe they lost weight, or maybe they're shaking their head, as opposed to being a head shaker, two completely different things. And the dental part of it is such a major thing because some of these horses, that's where the problem is. They don't have like bad systemic disease, losing weight. They actually have a problem in their mouth and they're just not eating. Or the horse is very difficult to ride because it actually has, no, I'm trying to tell you I have a sore tooth, or I'm leading to a sinus infection because of the sore tooth. And it's not anything more than that. And it's one of those cases of just doing the basics really well, looking in the horse's mouth. And you gave us a great outline there of everything that's offered at Rood and Riddle, but you want to talk to us today about something that's very specialized.
Sure. And I appreciate the involvement with the other services. It's something really great about our hospital. Everyone works really well with their own strengths, and we've helped the medicine out a number of times with those types of cases. But today specifically, I really want to talk about restorative dentistry. Restorative dentistry is a little bit of a buzzword in the human field, and it's probably a surprise to a lot of listeners that we can do restorative procedures for our horses. I really got into this because it's an opportunity to save teeth, right? Or it's an opportunity to save the function of a horse's mouth. We're talking about an animal who will chew preferentially 16 hours a day. I'm a grazer. I don't always eat. I don't always eat my 3 meals. I'll snack in between, but 16 hours, that's a lot of chewing.
That's a lot of chewing.
Yeah. And it's interesting you say that because it's like a paradigm shift. Like once upon a time, you had the horse's teeth just got to the point where they weren't good anymore and they just got pulled out. But horses live a lot longer than they used to, and they need those teeth for a lot longer than people once upon a time thought that they did. And so you're right. We've got to save these teeth for the good of the horse.
Well, but not only that, Brad, as you alluded to earlier, a lot of owners think of oral care as being floating teeth. Mm-hmm. A lot of veterinarians think of that too. And I don't know what kind of training you got in vet school, but mine was an afternoon lab, right? Yeah. So I think so much has changed over the past 20, 30 years, whatever it is, 10 years. A lot's changed in the last 5 or 10 years. So there's just so much more that we can do now.
The most surprising thing you just said? That he actually went to vet school.
He didn't say he finished.
Yeah, maybe it was just eat his lunch. I wasn't sure, but I think he's turned out okay.
I would say so.
I think Pierre straightened you up.
Yeah.
Yeah. No, good point. I mean, historically speaking, we were not trained real well in the field of dentistry because there was no field of dentistry. It was floating teeth, right? Digital radiography changed everything. It really did. Having the ability to take images in the field and reevaluate them, that changed everything. And then we got equipment that was safer where we didn't lose fingertips trying to open horses' mouths.
Yeah.
Safer sedation was a huge part of that, right? We used to be a little bit more big of a deal to sedate a horse.
Sure.
Now we do it routinely. Always take precautions, but something we do on a daily basis.
Yeah, I don't know how you would do what you do without access to good standing sedation because it's very dangerous in there.
I agree. I want to keep all 10 of these digits.
Yeah. Why don't you show us some stuff you're doing?
Yeah. I got a picture here. And so, back to the education and training, getting these images, being able to look inside the horse's mouth, it's huge, right? I mean, you got to be able to open the mouth up, put a bright light in there of some sort. The images I'm going to show, here's one right here. These are endoscopic. So this is what I do routinely, put in a endoscope inside the horse's mouth, magnifying, looking at all surfaces of the tooth. And so if you look here in the image, anytime you're looking at a horse's mouth, this chewing surface, the occlusal surface, there shouldn't be feed shoved in the middle of the tooth. That's pretty simple. You don't have to go to vet school. You don't have to sleep at a Holiday Inn Express. That should not be what happens. And so there's a green circle just popped up here on the screen for those who are able to see this rather than listening. That's circling a cavity. That's in the center of the tooth. It's a unique part. The horse's teeth are very different than ours. And they'd have to be. To chew 16 hours a day, our teeth wouldn't last, right? Our tooth is done growing by the time we finish puberty. Just toss 18 years of age out there for an example. We're done. We're brachiodonts. That tooth is done. Their teeth is called hypsodont. And it's a hypsodontal tooth. So it's very long and it's constantly erupting. So when that horse is 3-4 years old, the tooth inside of his skull is 4 inches long. That's a long tooth.
That is long.
I've removed many of them. That's a long tooth. The part that's actually outside that the horse is chewing on is usually less than a 1/2 inch. So if you're trying to take one of those out, it's like taking a fence post, breaking it off next to the ground and saying, here you go, son. pack a lunch.
Yeah. That image, I mean, not everybody's going to have the ability to see the occlusal surface like that, because if you're looking at that horse's mouth from the outside, there's no way that you could see that. So that's that endoscope that you're talking about. That just adds so much more to what you do.
Yeah, absolutely. Yep. And you can do this with a dental mirror. If you're skilled and used to looking in a mirror, you can use it as a dental mirror. But these are cavities, and I've got here's a picture of just what it looks like as we're doing our examination. This is, I'd love to tell you I'm working hard, but I'm sitting down here and driving an endoscope in a horse's mouth, but you can see it projected on a screen, right? And we can get as close as we want and magnify, and it gives us a great opportunity to examine every part of this horse's mouth, so we don't miss anything, because the anatomy is really complicated. The inside the tooth itself, it's there's some really good work that I've shown here that's out of Austria. And some researchers showed how complicated the blood supply is inside the tooth itself. There's 5 to 6 pulp horns in every tooth. And the way those pulp horns communicate in the blood supply to the tooth is important if you're going to start working inside the tooth. And for years, we didn't have this information. So we just did all of our work with filing away on the outside of the tooth or taking the tooth out. But once we started understanding inside the tooth the way our human dentists do, it just opened up a whole world of opportunities for us. So right there is 2 large blue, looks like, I don't know, maybe Lake Superior and Lake Erie. You guys might have better analogies than me. But those were the cavities for. The horse's tooth was made just really weird. In the very center of this is the last part of the tooth to develop. And for some reason, they don't always develop properly. It's like having layers of stucco, and if you miss a layer, you end up with an area of gas or a gap. And these horses' teeth, 80% of them will have a gap somewhere, a void in the middle of that tooth. Most of the time, it's not a problem. But when it does become a larger void, that's where those images I showed you come into account. That's where feed gets shoved in there. Well, then it's no different than you or I. The bacteria starts setting up. If you don't brush, you don't floss. I'm going to be that parent. If you don't brush, you don't floss. Bacteria is going to set up. The pH of your oral cavity around that tooth is going to get down to about 4.5. So then you get tooth decay. So that's what those images really were showing, was tooth decay. That's what all that black area was.
Yeah. So that picture of that tooth that you showed, it looks very complex. How does that compare to like a human molar?
Oh, it's infinitely more complicated. Human molar has got, it's got a biclave surface. It's got undulations on it. You got to have a chewing surface. The horse is made to grind its food and chew like a herbivore, because it is a herbivore, right? And it is chewing all the time. So the enamel actually goes across the chewing surface to give the more strength to the tooth. Well, enamel is like peanut brittle. Peanut brittle is hard, but it's easy to snap. Enamel is exactly like peanut brittle. So you have to put a product called cementum, another mineral, around it to support it. So cementum sounds like cement. It is like cement. It's just holding the enamel together. That is not how our teeth are made at all. So it's just complete different. The minerals are the same, enamel, dentin, and cementum, but the way they're organized is completely different. And some of it goes haywire sometimes, just like their guts apparently aren't made right sometimes. Yeah. Same thing with the tooth.
Gotcha.
Yeah. I'll show you, this is kind of, we look at these cavities, use the endoscope and try to grade them and stage them. And nobody here is going to get an exam later, so we won't talk about this too long, but at some point the tooth is going to break. And so if it's a young enough horse and it meets certain classifications and we decide that this is a good one to do a restoration on, a restorative procedure, then the idea is you would treat this tooth rather than let it break and potentially cause a sinus infection or cause a problem for the horse. And so this is what that looks like. The picture on the left here with the blue arrows, there's actually a high-speed drill that I'm using to burr out the decay. So this would have been black, nasty, shoved full of feed. I'm using a burr no different than what your human dentist would use. It's just a slightly larger size. It's a number 8 instead of a number 4 burr that a human dentist would use on a human handpiece to burr out a cavity in our mouth. So if you've ever been at the dentist office and you heard that zzz sound, that's the same exact thing.
Too many times.
It's not pleasant.
No.
Yeah.
So the other thing about this is, for horses, these are not near the nerves.
I was going to ask if you have to block them and get the pain.
So we do a lot of nerve blocks, but for this, we don't need to. Okay. These are outpatient procedures, very routine procedure. Unfortunately, not enough people in this country are doing them. It's very unusual. Not a lot of people are doing them right now. Training's kind of lagged behind, but in the future, you're going to see more and more of this. This is something we've been doing in this practice for the last 7 years now, I guess. And so the picture to the right shows the restorative going in. This is a restorative no different than what might be in my mouth or anybody else who's had cavity fillings done. These are all human products. They acclimate really well in the horse's mouth, and they do hold up to the attrition of chewing, which is really important.
Mm. Yeah. You mentioned about the tooth breaking. Does it like shear horizontally or does it split vertically?
Both can happen. Typically what happens is it will shear vertically. So when it shears vertically, it either shears in one of two areas. One is through the 2 pulp horns on the outside, or 3 pulp horns towards the inside, towards the palate, or right down the middle where these cavities form. And so it's a split between the two. The ones that are going to split over the pulp horns, there's nothing we currently have to stop that. That's an area for future research, future development, exciting area of medicine. What we have now is the ability to stop the ones that split right up the middle. And so that's where these lesions are, directly in the middle of those upper teeth.
So when you fill those cavities, what the filling material, does it wear at the same rate as the rest of the tooth?
It does. It was really concerning. I'd say we started doing these around 2015, 2016. It was very concerning which product was going to, because there's nanofills, there's microfills, there's all these different products that are available in human medicine, bulk fills, single layers. It's very complicated, a whole science. And there are dental specialists who are just endodontists. That's all they do, is work inside a horse's tooth, right? Or sorry, human's tooth. Horses, we don't have this. You got a dentist, and you're lucky to have one of 20 boarded dentists in the country, right? So it's we're just not that specialized yet. It's a huge area of growth for us, but we're lucky to have enough research at this point to show that yes, it'll wear at the same rate as the surrounding cementum. Now, enamel is the hardest substance. We don't need anything that hard in there because the concern is you're going to cause shear forces of your own. So it does wear an attrition rate the same as the surrounding cementum.
Gotcha.
Yeah, that's an awesome question.
Yeah. So carry on with cavity filling and what comes next.
Yeah. In an ideal world, you locate it, you identify it early in this horse's life. Let's say a horse less than 15 years old. If it is deemed to be deep enough or aggressive enough, you monitor it over maybe a couple of visits, 6 months apart. And then you have a conversation with your owner and say, hey, this is trending the wrong direction. Are you comfortable taking a chance? This may break. This may go the wrong way. Or here's an opportunity. We can do a cavity filling, a restoration, and we can assure it's not going to be a problem for you.
So the cavities are not painful then?
They are not.
So it's more just you're worried about the function, longevity of the tooth.
That is correct. It's not painful until it breaks. That is correct. Not all of them are going to break. So it's just an honest conversation you have to have with the owner.
Gotcha.
Like everything we do in practice,
Yep.
Share the information. That's what you come here for. You come to Rood and Riddle to get an answer. And, we share the information with you and you have to make the decision.
Right.
Yeah. The next thing I wanted to talk about, if it's okay with you guys, was oral fistulas. And this has been around forever. These have been problems for a long time. This is when a lot of times this is when the tooth's already gotten infected and it's draining out the side of the face or the side of the head or into the sinus. And now there's something really nasty smelling. Because that's when the owners call you, right? Yeah. They call you when the horse can't walk and he's holding his leg up or something stinks. Don't call me for the foot abscess, but the something stinking I can help you with, right? And so this is a whole lot of what we do. There's a picture here now that just shows this is an endoscope inside the mouth, looking down with a little guide wire through the endoscope. You guys are familiar with that, a wire you'd use to go into a guttural pouch. But it goes down this tooth socket, and there was a jaw fracture here. We'd known about the jaw fracture. It had formed a bone callus, but the tooth got infected and broken at the same time. So we ended up having to remove 2 teeth. Well, anytime you take out 2 teeth, you've got a large hole in this horse's mouth. The horse is chewing constantly, and it's hard to keep feed material out of there. And you've got this draining tract that goes through the jaw fracture out the side of the face. And that's a conundrum. And so I've got a couple of innovative things that we've come up with to try to solve problems just like this. Because the easy ones are going to treat themselves. Just stay out of the way. And I think that's probably true of foot abscesses and breeding mares and lots of things that we do, right? But these, it's the more complicated ones that get us thinking and working together with teams and like-minded folks here at the hospital that really makes it what we do very exciting. That's a zoomed in image of the jaw fracture. But this is, for the longest time, this is what we've used to take when we take out teeth, is we got to plug that hole with something. Right. So if you just take out a tooth, whether it was infected for any various reasons, maybe it was a cavity that tooth got sheared and broke and got rotten and had to be taken out. We either use dental base plate wax. So it's just a wax you toss in hot water, mold it, you make whatever you want out of it, but we'll put that in there as a placeholder. It's designed to come out in a couple of weeks. Sometimes we'll use a thicker product. This is impression material. So this is what they would actually use around that's actually not true. Now they would use lasers and they would scan our teeth like they would when they create Invisaligns if they were trying to make an impression of our teeth. But we're all old enough to remember gagging with stuff in our mouth as they put the impression down, and you feel like it's in the back of your throat. Yeah, that was some of it. Those are the days. So this is that stuff, right? And so we make this 2-part material, same as what a podiatrist would use on the bottom of a foot around for frog support, impression material. And so we'll put this in place. And so it does a really good job of bonding and shaping to the tooth socket, the actual shape of the tooth socket. But sometimes these don't stay in place. That case I was talking about where you had 2 teeth in this horse's mouth missing side by side. That's a huge gap. Those teeth are wide and long, and it's hard to put a big old wad of bubble gum in there and expect it to stay. And it doesn't. Yeah. I'll fast forward to the end. It doesn't. So. And we're done. So we had to get a little bit creative. So what I've done is found a way to create crowns. And when I say crowns, we think in human dentistry, a crown is meant for us to have a pretty tooth where we didn't have one, or one was broken or missing, and we chew on it. Horse is a little bit different. We haven't gotten there yet. I'm not going to say we won't get there, but there's some things to overcome, hurdles and future studies for that. But currently, when I say crown, I'm thinking it does look like a crown, but it's not down into the chewing surface. So it doesn't come all the way down where the other teeth are, but it's a placeholder. It fills in the space, the gap, so that feed doesn't get shoved in there and just sit and rot while we're waiting for the tissue to heal. Because we take these teeth out, we want it to just fill in with normal gum, healthy tissue all the way up to the gum line. And they do, if you can get rid of some of the infection. So this is what we came up with. Nobody showed me how to do this. We just did an impression. I had a mentor who was doing crown bridges a little bit different. So I, made a modified technique because I don't have the time of day that he does to sit and spend 2 or 3 hours making these. So I got more courses to look at before the day's over. So made a mold and a negative impression of the tooth socket, and then poured it full of crown bridge material. So on the image on the right, the top is that big bulky blue impression material. Below it is an actual proper crown that will fit perfectly up into that tooth socket. And then I bond it and attach it to the tooth in front and the tooth behind. So here it is, diagnostic, here's endoscopic images. And the picture on the left shows this tooth socket. It's hard to tell two-dimensionally. This thing was 3.5 inches tall. If you look at the surface of it, it was really narrow. It had started healing. The sides had healed in really nicely, but the top just would not. And it wouldn't because there was too much bone missing. If you have more than 1 inch of bone missing, these things are a devil. And this was Lucifer. So, the picture in the middle shows the actual crown placement and bonding. The one on the right is a follow-up, and looks like it was about 4 weeks later. The horse had done some chewing, some eating, and it was staying in rock solid and just worn away some of the thin layers, but it stayed in place, did perfectly. I took that one out last month, and it was completely healed. So they can stay in there permanently, or they can be taken out once everything is healed. The ones that are a little bit more hard are the ones like I showed with the jaw fracture. This is the one that had the jaw fracture, 2 teeth missing. And this doesn't do it justice looking at the image. It was 4 fingers long. I mean, this was a large space. Very healthy tissue everywhere except at the very bottom where the bone was. And so did some work on that. That was a surgical approach. But then we had to make sure we didn't get a bunch of feed shoved down in there or we're going to be in the same boat again. So did the same thing, used the same techniques, created a crown bridge, and we were able to bond this in, put it in place. This one I left in permanent. And this horse had drained. The horse was shipped in from out of state. It had had 4 different surgical procedures before it came to us. It had seen 6 different veterinarians. Lucky number 7, I guess. And so spoke with the owner and worked on this horse off and on for 3 different visits, and we got this horse squared away, and we got a Christmas card. So
okay, excellent. That's good.
That's got to be something, right?
That is.
So that's pretty impressive stuff. I mean, there's a lot of thought that goes into this. And you mentioned there's really not too many people that do this, but you mentioned that some people overseas. So where is a lot of this knowledge coming from? Who's leading?
Yeah, no, it's a good point. You know, we're pushing forward. You know, I would say in this country, we are leading the way. We're really pushing forward, being as innovative as we can possibly be, just like we are in a lot of other fields in this practice. But as you look overseas and abroad, there's a good bit of information that's coming out of Germany, Austria, specifically endodontics in England. There's a couple of practices in England that are really publishing great information that we collaborate together, we speak together, we speak at the same national meetings together, and just a ton of valuable information coming out of England right now that's helping us do a better job to help a lot of horses save a lot of teeth.
And you made a good point earlier about, imaging, right? Because once upon a time, the horse's mouth was just this long, dark cavity that smelled, and that's what got your attention for it. But now you can actually get some really up close and personal looks at the tooth grossly, like, as you say, like the mirror or those endoscopic pictures are amazing. And then you image like with the CT and even the MRI to look at the pulp within the tooth. I mean, that's pretty impressive stuff,
Pretty
Brad.
advanced, yeah.
Yeah.
No, horses are fortunate to be in this area because having access to a CT unit of this quality that can be done standing with no more sedation than you would need just to, clip ears.
Yeah.
Right? I mean, that's all they need to be, just sleep enough that you can clip their ears. With some horses, that might be a bad example. But
Yeah.
Yeah.
But yeah, I mean, being able to take a CT and look inside the horse's teeth, oh, it's unreal. I mean, you can tell immediately what's going on. Can I save this? Can I not save this? If I need to do a surgery, what's the best way for me to take this out so I can use a minimally invasive technique that's better for the horse, better for the owner's pocketbook, and a quicker recovery, right? And that's what we're really all about.
Yeah. And getting back to the broken tooth situation that you talked about before, like shearing, horizontally, that's one thing. But if the tooth actually gets to the point where it is split vertically, is there anything that can be done to save that, or is that just automatically removed?
Depends on where it's sheared.
Okay.
The one that's sheared vertically through the center of the tooth, that one's automatically removed.
Yep.
That one's going to involve the common pulp at the very top, and so the whole tooth is going to be diseased. The ones that are sheared on the sides, we have the ability to do root canals. Okay, so if we find it at an early stage where we have good quality radiographs or sometimes a good quality CT study, we can look at the actual tooth roots. So there are 3 roots on those top teeth, 2 roots on the bottom teeth. If we look at it and there's not major disease at the depths. So maybe the tooth is diseased in the center. We know it's diseased, it's broken, there's feed shoved in there. There are things we can do to perform a root canal, which I've done on a number of horses, to save that. But it's very time critical in those cases. Now, the ones we find right when they broke, usually it's incisors. Owners notice that whenever things are bleeding in the front of the mouth, those we can do a vital pulp therapy. It's called a pulp capping. We can do a vital pulp therapy, a restoration. I can actually recreate the shape of the incisor, do a buildup, and give you a relatively normal looking incisor when we're done. And that tooth stays healthy. No different than what you and I would have done on our teeth. But that needs to be done in the first 72 hours.
Yeah, and that actually touched on point, because you've shown us a lot about molars, right? But to know that things can be done with incisors as well is quite surprising, because the anatomy is so much different.
Correct. And the incisors, we're very fortunate. Incisors are simpler 2 pulp horns that connect really close to the surface into one common channel. They behave more like a brachiodont tooth. They continue to grow their whole life. They're a hypsodont tooth, but they're much easier to work on, much less complicated. And then obviously access is the other thing.
Yeah.
they're right there in the front. They're very easy to reach. We're using human products and we're adapting them to use them in a 1,200-pound animal a lot of times.
There's a lot of that. Those jaws have a lot of power.
Oh yeah. Yeah, the forces are involved in horses chewing, like grinding the feed, but even the bite, with those incisors, I mean, I don't know how any material that you can put in there stands up.
Right.
It's impressive. Well, Brad, this has been fascinating stuff. This restorative dentistry, I mean, this is something that really is sort of on the edge, and it sounds like there's a lot of teeth that could actually be saved and be useful for the life of the horse, which again, as I mentioned before, is extending so much that we just don't want a 30-year-old herd of gummy horses. We've actually got a chance they can have that sort of pearly smile into their old age.
Yeah, and just something that people can know is possible, right? And a lot of times there's problems going on that people might not recognize. So it goes back to that thorough dental exam and being regular about them.
Yeah. Yeah, and these are things that people have for themselves, so they want it for their horses. So we're actually glad you're out there doing that sort of stuff. Puts the pressure on the rest of us to do something, doesn't it?
A little bit, yeah.
Okay, well, Brad, thanks for coming in to see us again today.
Yeah, thank you. Appreciate you being here with us. That was great.
Thank you, guys.
Right.
And that was Stallside for this week. We were with Dr. Brad Tanner of Rood and Riddle Equine Hospital, boarded dentist, talking about restorative dentistry. See you next time.
Stallside Podcast is brought to you by Rood and Riddle Veterinary Pharmacy. As partners in your animal's healthcare, we strive to bring you the highest quality medications, including custom compounds, that are formulated and produced right here in our pharmacy. Along with medications, we also strive to bring you high quality and relevant information, such as that available here on the podcast. So if you like what you hear and see, be sure to refer us to your friends, and remember to hit that like button and subscribe to our channel. We've done a lot of great episodes already that you may need to catch up on, with more just around the corner. One last reminder, nothing you hear on the podcast should be construed as veterinary advice, which should only come from a veterinarian with whom you have a relationship.